in chiropractic, there is many, many different techniques. I've heard somewhere upwards of 200 different techniques. When it comes to finding a chiropractor that works with you, this is what I tell people that, I think chiropractic works 100% of the time, but not every techniques work with 100% of people. So really trying to find what is best for you and what you're looking for, whether it is a technique that is more maybe aggressive in nature. Maybe you like that. Maybe you like those deep tissue massages and you like that type of stuff. You're an athlete and you really think somebody has to really, work your hard to make sure things move. That I may not be that person for you. But if you're a person that has long-standing health issues, things like migraines, headaches, dizziness, vertigo, balance issues, tinnitus, Meniere's, there has been a plethora of studies that say this very gentle, very specific technique called upper cervical can help with those things. And when it comes to trying to find that person, unfortunately with upper cervical practitioners, there's very few of us. There's about 100,000 licensed chiropractors out there. And out of those 100,000, there's about 1,200 of us that practice this specialty. So reason why I'm involved with not only furthering my technique as being the VP, also with the Upper Cervical Council, I'm working with them to further the studies of chiropractors to make sure that they understand this is an option for them, that they can add this into their practice to be more specialists, to deal with very complex cases like traumatic brain injury. I mean, there's so many people out there that are suffering with traumatic brain injury and they're told they're crazy. They're told, their brain looks fine. They're told that everything is just hunky-dory and what they're feeling as far as depression, vertigo, dizziness, migraines, headaches, all over body pain, digestive disorders that come with these things, that they're crazy. And here, take all these drugs, these antidepressants, these painkillers, whatever, they're only throwing drugs. Even the top places in the country that deal with traumatic brain injury, that's all they have to offer, especially after they've been cleared of any sort of brain trauma, like, any, bleeding in the brain or anything that would need any sort of, emergency room type care. They're just kind of left to be told that they're crazy. And this is what we get to see coming in. This is the exciting things that we get to see coming into our office, that we can actually help these people. And that just makes everything worthwhile in the studies that I do and the boards that I'm on and things of that nature. It's really incredible what we get to see. The history of chiropractic, well, it started in Davenport, Iowa. D.D. Palmer was the founder of chiropractic, and then his son, BJ Palmer, and he is the developer. So they're the ones that basically started this process. It is said in 1875 is when chiropractic was born, when the first chiropractic adjustment took place. And it was a janitor that was working there and basically said, hey, I've been deaf ever since I've had this fall. And right back here is where it started to hurt. And there was a little lump there since his fall. Well, he said, okay, well, let me go ahead and try and adjust this. So he did an adjustment. And as the story goes, that he could hear the clippy clop of the horses outside the window after that, where he had never been able to hear that before. So that's kind of where it started. So it started with Dee Dee saying, okay, well, if the misalignment of the spine, putting pressure on these nerves, irritating them, caused this problem, removing that interference is what is going to help correct the problem. So, really looking into how all that works, I think is really important when you look at how the nervous system works. A lot of people think that chiropractors are back doctors. That's one of the myths that I hear all the time. Yeah. Are we really good at taking care of back pain and neck pain? Absolutely. Okay. That's low-hanging fruit, obviously, for us. But when it comes to really what we do, we are actually nerve doctors. Our whole goal is to remove the interference of the nervous system so your body can function better. Typically, when we're talking about different disease processes and things, I don't say that we actually heal those. What we do is remove the interference from the nervous system so the brain can effectively communicate to the rest of the body. There is not an organ, tissue, cell, anything that's going on in your body right now that isn't controlled and coordinated by the brain. Your heart doesn't know how to beat. Your lungs don't know how to breathe. Your digestive system doesn't know how to use that food you just ate. Everything is controlled and coordinated by the brain. And the information highway that it uses is down the spinal cord and the nerves that exit. So as chiropractors, we work on the spine, right? We're removing that interference. They're called subluxations. This is a misalignment of the spine that's causing pain, a problem, dysfunction in the body. So what we do is we find those areas, and what we're looking for, we actually look for areas in the spine. So if I'm feeling your back, if I'm feeling your spine, your neck, what I'm looking for, they're kind of pussy areas, somewhat tender. They're not moving right. That's what a subluxation is. That's a problem, and that needs to be corrected. So as chiropractors, we are trained to find those areas. It's interesting when patients, they're first on my table and I'm just doing the initial exam and I'm looking for subluxations. And they're going, wow, I didn't even know I was sore there. How did you know that? So, well, it's over years of training. You find those areas. You can feel how things are not moving. You can actually feel the heat, the tenderness, the tightness, the puffy, inflamed areas of those joints not moving right for an extended period of time. So when we finally get to, see a patient, we're going, okay, here it is. Here's the problem. This is why you're having that back pain. This is why you have, that pain going down your arm into your fingers or that numbness or tingling. This is why, you're having some digestive distress. This is why you're having a headache, those migraines. So if we give them the why, and then we give them the solution, it becomes really easy to make a decision. Okay, this is what I need to try. I've tried XYZ. None of it has actually corrected the problem. But somebody's actually telling me the why instead of just, oh, here, take this drug. Oh, here, try this. Because basically all that is just trying a chemical to put into your body to say, okay, let's cover this up. Does it ever actually correct the problem, or does it keep coming back? Ask yourself that question. Do you have those migraines because you have a lack of, ibuprofen in your bloodstream? No. That is simply there to cover it up so you can maybe get through your day, which sometimes is necessary, but what if you can find something that actually works with your body? Something that actually is going to correct the problem in the first place so it doesn't keep coming back. To me, that is more logical than taking something for the rest of your life that is simply just going to cover up the problem and could quite possibly cause further things. I mean, you look on just the back of your ibuprofen bottle, you can see a list of contraindications. You can see a list of side effects. When I'm talking to my patients about side effects, okay, you could get a little sore. Well, you do that when you go to the gym too. Does that work out bad for you? So sometimes we do have a little soreness because, it's like a passive exercise. We're working the muscles of the back. We're introducing new nerve function to muscles that have possibly been, asleep for a really long time, and they're finally waking up. So those are some of the things, as far as side effects that patients can have, and increased energy, increased organ function. We actually measure that in our office. We measure increased muscle function. We measure heart rate variability, or, how your body deals with chemical, physical, emotional stress. We measure all that to see how those things are changing because of the chiropractic care. So it's not just about the adjustment. That's the most important thing, but it's also how you're healing. Not just how you're feeling, but how you're healing. We have to make sure that we are always on target with that. So that's why diagnostics are also very important, and what makes our office very special in that area.